Your first question is about rural cases. And you are correct that just in the past 48 hours, 72 hours, nationwide, there has been a significant uptick in the number of cases detected in rural states and rural parts of urban states. You noted Iowa. I would also add I saw some rapid data that came out of North Dakota indicating a large spike there as well. Some of it is driven by the fact that testing is now permeating to those parts of those states. But other parts of it, I think, are related to what are somewhat unique aspects of rural parts of the country. In some cases, rural parts of the country offer some degree of protection. They are, by nature, in some instances, already physically distanced. But other aspects of rural life can put folks at a higher risk. Folks who live in rural parts of the state, of any state, may have jobs that take them into contact with people. They may be frontline healthcare workers or work in forward-facing consumer settings. They may also have less access to healthcare just at baseline. So I am deeply concerned about the impact of COVID-19 on rural parts of Maine. For going back several weeks now, several months, we have made it a point not just to touch base and work with facilities in urban centers, but also in rural parts of the state through healthcare coalitions, through the medical associations, through groups like that, to make sure that they didn't have a false sense of security. And again, what we have seen is now cases in rural parts of the state. Over the weekend, we recorded the first case in Piscataquis County, which up until the weekend had had no cases. So for those of you who are watching right now who live in a rural part of the state, even though there might be more cases in urban parts of the state, bear in mind that there are more people in those parts of the state as well. And so even if you happen to be in a rural part of the state, it's just as important for you to lead your life as if the virus was circulating around you, and try as much as possible to stick with the course and adhere to those physical distancing requirements. We are still very much in the middle of this. And what I hope doesn't happen is that we see a secondary bump in cases in rural parts of the state, because that would be a situation where healthcare providers may not have the same degree of resources. So for those of you in rural parts of the state, please take care.